I've helped countless people recover from medial elbow pain in my practice, and today I'm going to give all that knowledge to you, or at least the most relevant parts. In this video, you'll learn everything you need to know about elbow pain in or around the medial epicondyle, commonly known as climber's or golfer's elbow, including what causes it, what to do to fix it, and how long it takes to get back to 100%. We'll even add a bit of secret sauce that could be the key to unlocking your recovery. Thanks to Realand for sponsoring this video. More information about their amazing protein later in this video. All this information is for educational purposes only. None of it should be taken as medical advice or a replacement for seeing a qualified professional. Certain injuries such as ligament tears, elbow dislocations, snapping elbow syndrome, and bone fractures will not be covered here. Proceed at your own risk. What causes medial elbow pain? There are two common causes of medial elbow pain that we'll focus on: tendon pathologies such as tendinitis or tendinopathies, and nerve compression or impingement. Tendon pathologies are the ones most people are familiar with, causing diffuse discomfort in the elbow, a dull ache, which may be localized or spread out, or a sharp or stabbing sensation. This issue usually occurs from what we call overuse, which is a chronic buildup of tissue damage. If you're not familiar, this process happens because performing novel, intense, or repetitive activities like resistance training, hard climbing, or swinging a golf club can cause a small amount of damage to our soft tissues, including the tendons. This is not necessarily a bad thing. In fact, it's an important byproduct of training that signals our bodies to adapt and improve those tissues, so the next time we perform that activity, we're better equipped to handle it. However, those adaptations take time, and sometimes they haven't finished by the time we're back at the gym or golf course. We may feel like we're fully recovered because our muscles tend to adapt much quicker than tendons, but that doesn't mean all the tissues are back to 100%. Thus, a little bit more damage occurs to the tendons before they've had time to fully heal. Again, this usually isn't an issue in the short term. However, when this occurs over and over again, the slow buildup of damage to the tendon eventually becomes significant enough to make itself known as pain. So medial elbow pain that's caused by overuse is a result of certain tendons being constantly asked to perform more work than they can recover from. Specifically, the most commonly involved tendons are those of the flexor carpi ulnaris or FCU, the pronator teres or PT, and the flexor digitorum superficialis or FDS. Nerve-related pain, on the other hand, is a different beast. It's actually the one that constantly gets overlooked, which is partly why so many people feel like they can't get rid of their elbow pain. In fact, I even helped write a paper on this. Why is everyone making this mistake? Because most people think nerve symptoms can only be a tingling or burning sensation. But that's not actually true. The real symptoms of nerve compression are diffuse discomfort, a dull ache, which may be localized or spread out, a sharp or stabbing sensation, or a numbness, tingling, or burning sensation. Sound familiar, right? Turns out nerve symptoms in the elbow can mimic the symptoms of a tendon pathology. So if you have any of those overlapping symptoms, you shouldn't immediately assume it's a tendon issue. Nerves are unsurprisingly quite sensitive. So when one gets compressed too much by a muscle, it tends to let you know. Compression of the ulnar nerve at the elbow is called cubital tunnel syndrome or CTS, while compression of the median nerve at the elbow is called pronator teres syndrome or PTS. Since the ulnar and median nerves pass through, under, and between muscles in our elbows and forearms, you can imagine how frequent gripping or pull-up-like movements could squeeze them. Now, with so much overlap between tendon and nerve symptoms, you might be wondering how you can tell which one is actually causing your elbow pain. This can be quite tricky to figure out because the activities that provoke your symptoms could be irritating either the tendon or the nerve, or both. For example, when you do a pull-up, you're putting strain on the elbow tendons, but the muscle contractions can also squeeze the nerves. However, there are some useful indicators to look for. Numbness and tingling are symptoms only associated with nerve compression. If you experience this as your primary symptom, it's a nerve. If you have numbness, tingling, or burning along with other symptoms like a dull ache, you might have a combination of nerve and tendon involvement, or you might simply have varying levels of nerve compression at different times. For example, you might sometimes have mild compression that causes a dull ache, and other times have more significant compression that causes numbness or tingling. So combination symptoms could be tendon and nerve, or just nerve. If your symptoms change with the nerve mobilizations or stretches I'll be showing you for the chest or shoulder, a nerve is involved. If your symptoms are constantly provoked when your elbow is bent, such as simple things like holding your phone for too long, a nerve is likely involved. If you're positive that your symptoms are only nerve related, then you should watch our video, How to Fix Nerve Tension for Climbers, instead of this one. If you think your symptoms are related to neither tendons or nerves, such as ulnar collateral ligament sprains, osteochondral dissecans, arthritis, snapping elbow syndrome, or any other ligament or bone issue, this video is unfortunately not for you. For everyone else, I recommend you complete the routine we're about to lay out, even if you're dubious about nerve involvement. Since it's possible for medial elbow pain to be caused by both a tendon and a nerve issue, the secret sauce we mentioned earlier turns out to be treating both issues. It's hard for most non-professionals to properly assess their own nerve issues, so it's worth performing the nerve exercises for at least a couple of weeks. It won't cost you that much extra time, and you could very well be surprised by the results. Bro, please forgive me for I have committed many atrocities against the bro code of climbing.
Tell me your sins, my dude.
Well, there was one person that was climbing and clearly needed to be sprayed down by beta, and I didn't. I let them climb without that advice. I forgot to take my shirt off during an entire session. And another time when someone asked for my advice and I forgot to give them the obvious note of just go up, bro.
My dude, try this.
What is this?
Try it.
Dude, that's some gnarly good whey protein, bro.
That, my dude, is plant protein.
Dude, just don't tell the other bros, okay? Because it's delicious. I feel so much better already.
No worries, bro. Hey, by the way.
Yeah?
Your project is soft.
No!
Yeah.
How do I recover? Before you begin this protocol, you should have a bit of context. Because there are multiple structures that can cause symptoms at the elbow, the exact recovery exercises needed can vary from one person to the next. That means a few things. 1. For the best chance of success, this program will take a broad, cover-all basis approach. While this method has proven quite effective in lieu of an individually tailored program, it does mean that the protocol involves a lot of exercises. But don't let that discourage you. It won't take long to get the hang of it. 2. We're not going to cover every single regression and progression of each exercise because this video would never end. If what we lay out here is too hard for your current stage of recovery, you'll need to regress the difficulty to the appropriate level on your own. Of course, if you don't want to deal with that, remember you can always use one of our pre-made recovery blueprints to make it extremely easy. 3. This is not a personalized program, so you may find there are exercises here you don't need, but that may be extremely beneficial for somebody else. 4. You will need access to some tools, namely dumbbells or a cable machine, a lever bar or a hammer, or better yet, any of our torque devices, and some resistance bands. Step 1. The first step toward recovery is the one no one wants to hear because it's boring and kind of stupidly obvious, but that's exactly why so many people make the mistake of overlooking it. So don't be one of those people. You need to reduce aggravating factors, which are the things that make your symptoms worse. As mentioned, often one of the causes of elbow pain is simply too much work being asked of the specific tissues. So you can't expect to recover if you keep piling on the same work. This does not mean you should stop all activity, but you need to cut back on the aggravating factors based on the severity of your symptoms. In general, if the pain from an activity does not exceed 2 out of 10 during and 24 hours after you do it, that activity is likely fine. If an activity causes more or longer lasting pain than that, you likely need to reduce the intensity, reduce the volume, or change the movement style to bring the pain down to acceptable levels. Step 2. Soft tissue mobilization or instrument-assisted soft tissue mobilization. STM and IASTM are both forms of massage therapy, which is a low-cost method that could have positive impact on your healing. It's not a guarantee, but it's thought to improve the alignment of new tissue, increase blood flow to the area, and increase neurological awareness of the area. Note, it is optional here. If you find that it irritates or even worsens your symptoms, it might be because the painful structure you're trying to massage is actually your nerve, and it probably doesn't like that. So if this type of massage makes things worse or does nothing for you, discontinue it. Step 3. Tissue stretches. Next, let's get into a few different stretches. Unlike the optional massaging, I do recommend you perform these stretches even if you don't notice an immediate change in your symptoms. It may take a couple of weeks for the benefits to show up. Up first is a combination stretch to loosen tight forearm muscles while mobilizing the ulnar and median nerves. To perform the flexor plus nerve mobilization stretch, simply start with your elbow in a neutral position, just gently bent. pull the fingers back to create a gentle stretch anywhere along the forearm. Then you'll simply try and maintain that level of stretch while you straighten the elbow and then fully bend it. Straightening and bending. While you're performing the stretch, you can modulate the intensity by how much you pull on the fingers or by how straight or how bent you place the elbow. Up next will be 2 pec stretches, one with the arm at 90 degrees to add a rotational component to the stretch, and the other at about 120 degrees to get more pec minor involvement. These 2 stretches are important because elbow pain can stem from nerve tension as a result of compression in the chest or shoulder region. Performing pec stretches can mobilize these areas and help alleviate this compression, leading to reduced elbow discomfort. Place your hand up on the object with your shoulder and elbow at 90 degrees. This is also known as like a pec 90-90 stretch because you got 90-degree angle here and 90-degree angle at your elbow. Then stagger your feet and simply lean forward and rotate away, kind of using my head to indicate that more. Leaning forward and away until you feel the right stretch in your shoulder. You might notice a difference if you lean versus rotate away. Whichever one makes you feel a better stretch in the pec region is what you want to do. It's also okay if you feel a little bit of stretch in the shoulder region. That's not the end of the world. It just shouldn't be painful. While you're doing this, it's also important to make sure that you are kind of pushing and driving with your back foot. You're not holding yourself up. That will really limit the effectiveness of the stretch. And you really want to make sure that you're not squeezing your mid-back to get deeper into it. That's like the equivalent of saying that to stretch my quad, I'm going to engage my hamstring. No, you're just pulling to get into the stretch. Same thing with this. You're not squeezing your lower back or your mid-back to get deeper into it. You're just going to push and lean into the stretch. To get into the 120 version, just simply slide your hand further up. Your forearm now may come off of the object. That's totally fine. But your shoulder should now be at more of a 120-degree angle. And then same things apply. Pushing forward with the feet staggered, rotating your body away to change the stretch, looking for a stretch in the chest or front of the shoulder, not engaging the mid-back. And final note with both of these stretches, if you do start to notice any tingling sensation, just lower the arm down by your side, let the sensation restore to normal, and then it's okay to hop back into the stretch. You can also, while that's recovering, just switch to the other arm, let that arm restore and hang down by your side, and then once you've done the 20 to 30 seconds on the other side, you can do it there. So if you notice that at about like the 15-second mark, you get some tingling in the hand, just have that be your time. You don't have to do the 20 to 30 seconds if you notice the tingling or numbness at around 15 or less. These stretches should not be painful. Apply only enough force to generate a mild stretch, and while a small amount of discomfort, like 1 to 2 out of 10, may be experienced, it should never be truly painful. If you do start to feel pain, reduce the stretch intensity by reducing the range of motion or the amount of force you're placing on it. Step 4, isolated nerve mobilizations. There are 2 primary techniques, nerve flossing, which is the gentlest form, and nerve tensioning, which is the most aggressive form. To be efficient and once again not make this video 2 hours long, we're not going to be performing those 2 techniques, but rather we'll add a bit more secret sauce and show you the ultra-efficient nerve floss plus tension hybrid technique. Just note, if you find this hybrid technique to be too aggressive, you should regress to the nerve flossing techniques, which we'll provide instructions for in the show notes, link in the description. To perform the hands low median nerve floss plus tension, simply start with your elbows flexed and kind of fingers curled into a fist, and then you're going to straighten the elbow, straighten the fingers, point them back behind you, like you're trying to place the palm of your hand on the floor, while also looking to one side. This means minimal to no stretch on my right, but yes to stretch on my left. So the right hand is flossing, the left hand is tensioning. Then I come back, and I just look the other way. Now the right hand is stretching, so that's tensioning, and the left is flossing. And then you just repeat that. So you just go side to side, floss on one side, tension on the other, and it just switches back and forth with every repetition. If you do get tired of rotating your head or you feel like a little dizzy, you can always just lean away as well. Rotation or lean Either version works, just do what feels comfortable to you. If you do notice this causes pain, you can change a lot of the factors. Like you can let the fingers be a little more relaxed. You can let the elbow be a little bit less bent. You can even allow the shoulders to like shrug up some. You generally want to keep the shoulders down, otherwise you probably won't really feel the stretch. But if you do feel an intense sensation, any of those factors, including allowing the shoulders to elevate up some, will reduce the intensity. To perform the hands high nerve floss plus tension, start with your elbows bent and hands kind of just relaxed, funny by your side like this. And then simply straighten out both elbows while extending your fingers as if trying to point them up as much towards the sky as you can. Now, same thing with the hands low version. You're going to want to rotate and look at one side and then switch back to the other. So same thing with this next rep. I'm now flossing on my right, tensioning on my left, and then flossing on my left and tensioning on the right. The same tips apply from before, where you can modify different factors, like you don't have to point the fingers as high, you can let the elbows not bend quite as much, or you can pay attention to the shoulder positioning. But in general, if tolerated, keep the shoulders down, straighten the elbows, and point those fingers up as high as you comfortably can. Our final nerve movement will involve the ulnar nerve with different levels of intensity. The goal is to find a level that produces a light stretching sensation anywhere in the elbow, anterior forearm, palm, ring finger, or pinky finger. If you feel any numbness or sharp tingling, immediately reduce the range of motion or stop the exercise until symptoms subside. To perform the ulnar nerve floss plus tension, for level 1, simply start with your hands placed together, looking straight ahead, and then lower the hands down until you feel a stretch in the forearm, pinky, hand, ring finger, etc. You might also feel it directly in the elbow. You'll just go in and out of this position. For level 2, you'll hold this position while then looking left and right. This creates kind of our first true flossing plus tensioning technique, where we will get a floss on the left and a tension on the right, and vice versa. We'll also create a different variation of this with level 3, when we go into the position, but we then slide the hands towards one side and the other. In this case, we are now tensioning on the left, flossing the right, flossing on the left, and tensioning on the right. For the most advanced one of this video, for the ulnar nerve, you're now just going to combine the hand movement with the head movement. So we will look away from the hand that we're gliding to. So we'll go back and forth this way, which increases now the flossing on the left and increases the tensioning on the right, and vice versa here, increasing the flossing on the right and increasing the tensioning on the left. This might feel a bit more aggressive, so you can always modify how far you go with the elbows or the head. So for example, I feel a big stretch here on the left. I can modify that by just not sliding quite as far. With nerve floss plus tension techniques, there should be a gentle stretch in one arm at a time, but it should not cause pain or discomfort. Some symptoms may temporarily increase for a few minutes, but should not last longer than that. If you feel pain or discomfort, check your form. If you believe you're doing this correctly and still experience an excessive increase in symptoms, try to reduce the range of motion to reduce the intensity. If that doesn't work, discontinue this activity and consider seeking out more in-depth management of this issue with a qualified healthcare provider, as you may have some nerve tension contributing to your symptoms that requires additional management. Finally, we'll need to do some off-the-wall tissue strengthening. Of course, you might be asking, why are you telling us to add these exercises when earlier you said a primary cause of the issue is doing too much? Great question. Replacing aggravating factors with specific recovery exercises gives you a controlled environment to better understand your symptoms and how they respond to certain exercises. Your tissues heal better and faster when controlled, specific, well-programmed loads are applied to them. These exercises do just that while strengthening the surrounding muscles as a bonus. To start things off, the first exercise will be forearm pronation followed by wrist flexion. For all of these wrist exercises, you can use whatever device is available to you, which is pretty numerous in ways that you can do it. Like the forearm supination and pronation, you can use a broomstick, you can use a PVC pipe, you can even use a cable machine with a strap to help do it. So whatever's available to you will work. We're simply going to use the Torque Pro to demonstrate it because I find that to be the most fun. To perform forearm pronation, simply attach or anchor your weight. I like to start with it in a vertical position so I get my grip right, And then for this case, with the Torque Pro, the arc should be on the outside. Open your hand up, allowing the weight to lower down to a comfortable position for you, and then go through your full available range of motion. If you get stuck around here, probably just are using too much weight. If you have pain at this range, just kind of lighten that range so you don't go to your end-to-end range, and just go as far over as you can. It's okay if your wrist flexes a little bit in, but if it's flexing a lot in, it's probably because you chose too much weight. It's also okay if you notice a little bit of flexion at the elbow, because that is one thing that muscle does a little bit, so that's okay. But again, if you're having excessive movement in, might be a little bit too heavy, so just watch for form compensations. To perform wrist flexion, I'm going to use an adjustable bench because that way I have a nice forearm rest. I'm simply going to grab the Torque Pro with a thumb under grip, and then with my load attached, I'll go into extension and flex the weight up. I do like to have some stability and support here so you're not just engaging too much bicep by just holding the weight up here. And like I said, the adjustable bench is quite nice for this because they added padding, so it's a little more comfortable on the forearm, but any surface will work really as long as you have some support there. Go through all available range of motion if you can, and pay attention to the bar, especially you can kind of monitor this, because if all of a sudden you're pulling up and you're creating an uneven load there, you're biasing one side of your wrist more than your other. So you want to kind of use that as your indicator of, are you moving through this motion equally and controlled? Moving on to superset 2, we'll start with bicep curls and finish with finger curls. To perform bicep curls, just grab a dumbbell, hold it in each hand, start in a neutral position, so thumbs forward, and then you're simply going to curl the weight up while supinating, which means that at the end of the motion, your arm should be facing in towards you, or your palm should be facing in towards you. We want to have that supination moment to control with the different muscles at the elbow. We don't want to just perform a straight hammer curl variation here. You can do this both arms at the same time or alternating, whichever form you feel that's nicer for you. To perform finger curls, simply hold dumbbells in each hand and then lower them down. I like to do it not right when I feel like they're gonna fall completely out of my hand, but if it feels like my pinky's gonna come off, then that's usually my sign that I've gone deep enough, and then curl them back up. So you don't have to lower them so far where you're about in a 3-finger drag and you're gonna fall off. Just go to towards the end of your pinky finger, curl back up, and repeat. Now you're not doing wrist flexion here, so you just curl down through the finger range of motion, making a fist with the dumbbell each time. If this routine is new to you, I recommend only performing each superset twice per session. That way you don't add a ton of load right off the bat. Once you know you can tolerate that, add in a third round. Perform each superset in the order we presented here, completing all rounds of one superset before moving on to the next. How long will it take to recover? If it turns out that it was just your pesky nerves causing the issue the entire time, you should notice a quick improvement in symptoms within a few days to a few weeks. Though, keep in mind, you might have to manage this long term, and some nerve symptoms can take much longer to fully resolve. If you do notice an improvement with the nerve techniques and stretches, keep them up. If it's a regular old tendon pathology, it can take 2 to 4 months to recover depending on how severe it was initially and how well you program your recovery. Remember, if you want to take the guesswork out of recovery, save yourself a whole lot of time, and get a program that's specifically designed for recovering from medial elbow pain, which combines stretches, nerve mobility, and strength training all into one convenient routine on your phone, you can get that today on our website at hoopersbeta.com/recovery blueprint. These are the exact injury-specific programs I've used in my practice to help hundreds of climbers get back to on-the-wall pain-free. They'll take you from the earliest stages of healing all the way to regaining full strength and returning to peak performance. Our recovery blueprints are a proven way to fast-track your recovery and get you climbing hard again. And we don't just have elbow recovery blueprints either. If you've been dealing with finger pain or TFCC or wrist pain, we've got you covered, with more to come in the future as well. Alternative forms of treatment. If you're struggling with elbow pain that doesn't respond to load management, strength training, or nerve mobilizations, the first step would be to seek professional medical advice for individualized treatment. But here are a few other options that you should be aware of. 1. Injections, including cortisone, PRP, and prolotherapy, among others. 2. Extracorporeal shockwave therapy, which is a non-invasive treatment that delivers high-energy acoustic waves to the painful tendon area. 3. Dry needling, which involves inserting thin, sterile needles into specific myofascial trigger points, or muscle knots, in the tight forearm muscles. 4. Bracing, which can help if you're experiencing symptoms from your elbow being in certain positions while you sleep. 5. Ice, which can help some individuals immediately after an activity to calm a reactive tendon or nerve. 6. Heat, which can relax tight muscles and promote blood flow. Just to note, none of those are in any kind of specific order indicating how effective they may or may not be. Don't forget to use that code hoopersbeta at checkout for 25% off your entire Realand order. If you're interested in reading that research paper I mentioned, just email pt@hoopersbeta.com. Until next time, train, climb, send, and repeat.